SLT Mobitel, the connection.
කොරෝනා වෛරසය 99.9% දක්වා විනාශ කිරීමට උපකාරී වන Surf Excel Hygiene Boosters.
Tonight, planning ahead. Government seeks surplus vaccines from Indonesia and Africa as expert outlines plan to ease pressure on health services.
So the initial 3-4 days, even in those who are going to be symptomatic, are not going to be really troublesome. So they can actually manage at home initially.
Stay in your area. No interprovincial travel from midnight tonight, with a host of other restrictions also announced. Development funds. The government to seek $200 million tranche from ADB Highway Investment Program. Changing tune. Government rejects Ontario's Tamil Genocide Week ruling that contradicts official Canadian stance. All that and much more coming up on First at 9, this Tuesday, the 11th of May, 2021.
ඇල්කොහොල් අඩංගු hand sanitizer භාවිත කරන්න. ලෙඩ රෝග ඇති කරන විෂ බීජවලට එරෙහිව සටන් කරන්න.
From AdaDerana, this is AdaDerana First at 9. Live from Studio 24 in Colombo.
Good evening and welcome to First at 9. I'm Dhammike Kanaik. Now, medical experts are urging the government to consider home quarantine of COVID patients who aren't showing serious symptoms. This, they say, would ease the pressure on the country's healthcare system as hospital beds are running out fast, despite more being added to the system. At present, all novel coronavirus patients are taken to hospitals, irrespective of what level of symptoms they show.
Lack of beds at intensive care units and hospitals seems to dominate social discussions, especially in view of the large surge in daily COVID caseloads Sri Lanka has seen in the couple of weeks. At present, all COVID-19 infected persons are taken to hospitals, irrespective of whether they are asymptomatic or not. Given the rise in infection numbers, it is understandable that allocated hospital beds would run out, with more and more needed to be added to the system to address the shortfall. But the Sri Lanka Medical Association believes the stress on the health system can be eased rather easily.
So the initial 3-4 days, even in those who are going to be symptomatic, are not going to be really troublesome. So they can actually manage at home initially, and some of them remain quite okay, and by day 5 or day 7 they clear the virus and they become clinically very well. So those people, I think we should not unnecessarily admit to hospitals, but then we must have a mechanism in place where we could detect early signs of deterioration, early signs of problems, and then we should have a mechanism where everything is detailed so that the health authorities can quickly detect those patients and get them out into proper treatment centers for advanced care.
For a second consecutive day, the COVID caseload in the island crossed the 2,500 mark as 2,624 infections were confirmed yesterday. The Western Province maintained its unwanted record of topping the daily infections list, with its districts Gampaha, Kalutara and Colombo placed first, second and third in district-based daily caseloads. Gampaha reported 551 infections, Kalutara confirmed 362, while Colombo reported 321. Meanwhile, the Norelia district also reported 184 cases yesterday, and Kurunegala accounted for 177 infections. The districts of Galle, Ratnapura and Jaffna confirmed 170, 128 and 109 daily cases, respectively, yesterday. The remaining 571 infections were spread across 15 other districts. There were also 51 imported cases among yesterday's caseload. The third wave of the virus has caught Sri Lanka off guard, and the new variant sweeping across the world has done the same to other countries as well. What is notable in Sri Lanka at present is that the patient profile has changed to some extent, despite most of the deaths involve older persons and those with underlying conditions.
In this third wave, we do increasingly see younger patients needing oxygen treatment, ICUs. Actually, now we have done a survey. It's a very clear signal that more patients need oxygen. So it has changed a bit. Let's say roughly about 15 to 20% of patients who become symptomatic, they need oxygen. So actually that was an issue which we brought up with the President's discussion, and we emphasized that we should have facilities to provide more oxygen in case of need in future, and that is also an important point which we should consider when we consider the need to impose severe restrictions, because all health supplies are limited. There is a lid on everything. So no country in the world can confidently say that we can face up to any level of the pandemic.
In the meantime, 26 COVID-19 deaths were reported from the island yesterday. COVID pneumonia was the cause of deaths in 21 fatalities. However, the Institute of Health Metrics and Evaluation of the University of Washington predicted that 52 deaths would occur yesterday. As things stand, the recoveries from COVID-19 is at 106,641 after 1,030 patients were cleared to leave their treatment center upon complete recovery from the virus today. However, with the confirmation of 1,225 more cases, the active number of cases in the country rose to 22,287.
We're still in a perilous situation. The spread of variants, increased social mixing, the relaxation of public health and social measures, and inequitable vaccination are all driving transmission.
Won't you follow me into the jungle?
Now, with the public having expected an island-wide lockdown to be announced, the government instead offered something of a consolation last night by announcing a ban on inter-provincial travel from midnight tonight that will remain in place until the 30th of this month. Authorities explained that the decision to restrict cross-province travel was taken in order to bring about some control over rising COVID-19 cases while continuing to maintain a semblance of normalcy in the country's economy. Now, essential services will continue to be able to cross provincial borders, while essential service staff can only do so by furnishing official documentation provided by their workplaces.
Following a major increase in COVID-19 cases since the beginning of the country's third wave, the government last night slapped a ban on inter-provincial travel that will come into effect from midnight tonight and will remain in place until the 30th of this month. However, the new restrictions will not affect essential service providers, as the government aims to continue some semblance of normalcy and keep the economy running throughout. With that, essential service staff, including those employed in the state sector who are required to report to work during this period, will be expected to furnish an official document from their workplaces to authorities in order to cross provincial borders, the Secretary to the Ministry of Public Services announced. Accordingly, authorities commenced the setting up of checkpoints and barricades at provincial borders across the country from today in preparation. With that, the police department announced a cancellation of all leave for its personnel for the duration of the travel restrictions. The circular issued by the department has also instructed police personnel residing in areas not under isolation to report for duty with immediate effect. Police personnel residing in isolated localities, however, are not expected to report to work until the lifting of isolation in their areas. Meanwhile, police spokesperson DIG Ajit Rohana offered an update on police operations yesterday to crack down on quarantine law violations throughout the country.
Yesterday, 548 suspects have been arrested in connection with the offences of face mask, social distancing and other quarantine offences. Total number of 7,864 persons have been arrested in connection with the same offences. In addition to that, another operation has been conducted in Western Province. Since 4 p.m. to 7 o'clock in the evening, 92 suspects have been arrested in connection with serious violations of quarantine rules and regulations. The maximum passengers are limited to the seating capacity of buses. In addition to that, three-wheeler and taxi drivers should carry only 2 passengers in addition to the driver.
DIG Rohana also warned of stern action against those attempting to circumvent the travel restrictions through the use of byroads and other shortcuts. In the meantime, the suspension of inter-provincial bus services too was announced, leading to a rush by commuters to catch the last buses back to their hometowns before the midnight deadline. Accordingly, the Railway Department also announced a suspension of its inter-provincial train services. However, commuter trains within provincial limits will continue as normal. Meanwhile, the government has also ordered all liquor retail shops to remain open for business until 6 p.m. starting from today. In addition, the Department of Labour announced that the Employees Provident Fund claim section at its head office and divisional offices will be closed tomorrow and the day after. However, the EPF sections at its head office and divisional offices will be open from the 17th of May, but only for general claims by prior appointment only. Meanwhile, head of the National Operations Centre for Prevention of the COVID-19 outbreak, Army Commander General Shavindra Silva announced that the government has not ruled out inter-district travel restrictions if the situation continues to get out of hand. Meanwhile, addressing the media this morning, Cabinet co-spokesperson Udayagam Manpila assured the public that the restrictions will not hinder the continuation of essential services.
Statement from the President's office talked about restrictions, so not exactly a ban. Can you just explain to us what these restrictions are and from when this will come into force?
It is in force at the moment and it is in force until 30th of May. The government policy is that movement will be restricted without causing any inconvenience to the essential services. Then export-oriented industries, agriculture, fisheries. So these sectors will be operative, although we have already imposed these restrictions. So we have not discussed and decided in detail how we are going to implement. It's at the experimental stage at the moment. However, in most of the cases, the authorities would consider case by case and decide whether that activity is an essential service or not, rather than making a blanket policy for entire country and entire sectors at once. This is not something new. We did the same in the previous year as well. We had the travel restriction among provinces in last year as well.
In the meantime, Gram and Niladhari divisions deemed high-risk areas continued to be isolated today. Just today, 6 Gram and Niladhari divisions in 4 districts were placed under isolation. This included the Gram and Niladhari divisions of Uyanvatha and Uyanvatha North, falling under the jurisdiction of the Mathura police area. Further, the Gram and Niladhari division of Udahapuvida in the Mathale district in the Rattuta police area was also isolated today. Meanwhile, in the Kandy district, the villages of Tibbutta and Kuskastanna that come under the Valgampitiya Gram and Niladhari division were placed under isolation as well. In addition, the Gram and Niladhari division of Madakiri Matiana in the Putlam district was also isolated today. Meanwhile, the Gram and Niladhari division of Nikadaluputta that come under the Kumbukkate police area in the Kurunegala district was brought out of isolation after authorities deemed the virus risk to have dissipated to acceptable levels.
Now, Kuwait has suspended flights and barred entry to travellers from 4 countries including Sri Lanka. Bangladesh, Pakistan and Nepal too are covered by the move, which will be effective until further notice. Cargo flights, however, are not affected. To enter Kuwait from Sri Lanka, Bangladesh, Pakistan and Nepal, people must have been in another country for at least 14 days beforehand. Kuwait had said last week, that it would ban citizens who have not been vaccinated against COVID-19 from travelling abroad from the 22nd of May. President of the College of Internal Medicine, Dr. Harsha Satish Chandra, says that global studies are underway to determine the effectiveness of mixing and matching vaccines and revealed that results will be available by the end of this month. Meanwhile, speaking at today's Cabinet media briefing, Cabinet co-spokesperson Udayagam Manpila stated that discussions are underway with Indonesia and some African countries to look at purchasing surplus vaccine stocks to boost Sri Lanka's vaccination drive. The number of people in Sri Lanka to have been given the first dose of the vaccine against COVID-19 is creeping up on 1 million. At the end of the day yesterday, 954,695 people had been given the jab since the island's immunisation drive got underway on the 29th of January. What's more, 213,953 people have been completely vaccinated, meaning they are immunised with both required doses of the vaccine. With Russia's Sputnik 5 and China's Sinopharm vaccine stocks available, inoculations were done in several vaccination centres of the Western Province during the day. For the time being, the jab is, however, limited to people in the Western Province, with areas at high risk being given priority. Sri Lanka Army too supported the vaccination drive worked off in the areas of Maligavatta, Vellavatta, Mattakkuliya, Kettarama and Nugegoda. In the meantime, residents of Kotikavatta were inoculated using the Sputnik 5 vaccine during the day. Nearly 2,000 people of the Medical Health Division of Kaduwela were vaccinated with the Sinopharm vaccine. Elsewhere, over 1,600 people in the area of Ratmaldeni and Piliyandala too were given the Chinese vaccine. What's more, residents in Gampaha were inoculated with the same vaccine with the support of the medical staff of Sri Lanka Air Force and Sri Lanka Navy. Meanwhile, in the Kalutara district, people of 4 Grama Nilladhari divisions were inoculated using the same. Though the World Health Organization was late in giving approval for China's jab, the global body is now full of praise for the Sinopharm vaccine.
We did site inspections in China in January and February, and so the good manufacturing practices, the Sinopharm is compliant, and we also assessed the clinical data that's available for Sinopharm, and it was also considered suitable on efficacy and safety and good manufacturing practices.
Sri Lanka, like many other countries around the world, pinned its hopes on procuring vaccines on India. The country's Serum Institute is the world's largest vaccine manufacturer. But with the United States imposing restrictions on exporting required raw materials to make the vaccine and India's own COVID situation spiralling out of control, India too is facing a domestic vaccine shortage. But that doesn't totally explain why smaller countries are struggling to procure jabs. What's evident is money talks.
High and upper middle income countries represent 53% of the world's population, but have received 83% of the world's vaccines. By contrast, low and lower middle income countries account for 47% of the world's population, but have received just 17% of the world's vaccine.
With there being some people in the island who had been given the first dose of AstraZeneca with no availability of a second dose from the same variety, vaccine mix and match is being explored.
There are studies that are going on. One study in the UK using the AstraZeneca vaccine and the Pfizer vaccine. Another study in Russia using the AstraZeneca vaccine and the Sputnik vaccine. They are due to report sometime this month. Maybe it was the latter part of the month. So we will know more then. But we must also stress upon the fact that vaccines do prevent severe illness. So whether there is the belief in the scientific community is that probably mix and match will also work.
In the meantime, speaking at the Cabinet media briefing, Cabinet co-spokesperson Uday Gammampila revealed the government's plans to procure more doses of AstraZeneca.
AstraZeneca එන්නත ශ්‍රී ලංකාව මිලදී ගැනීමට ගිවිසුම්ගතව සිටියත් ඉන්දියාවේ ඇති වුණු COVID-19 රෝගීන්ගේ හදිසි වැඩිවීමත් සමග ඔවුන් පිටරටවලට යැවීම తాවකාලිකව නතර කිරීමෙන් ලක්ෂ 6කට ආසන්න යම් පිරිසකට දෙවෙනි මාත්‍රාව ලබා ගැනීමේ ගැටලුවක් මතු වුණා. නමුත් මේ වන විට ඉන්දුනීසියාවෙත් ඒ වගේම අප්‍රිකානු රටවල් කිහිපයකත් අතිරික්ත COVID-19 AstraZeneca ප්‍රතිශක්තිකරණ එන්නත තිබෙන බවට අපිට ලැබුණු තොරතුරු අනුව අපේ රටවලින් ඒවා ලබා ගැනීමේ සාකච්ඡා ආරම්භ කරලා තියෙනවා. ඒ වගේම ලෝක සෞඛ්‍ය සංවිධානයේ ප්‍රධානී සමගත් ජනාධිපතිතුමා මේ ගැන සාකච්ඡා කරලා ලෝක සෞඛ්‍ය සංවිධානය හරහා නිෂ්පාදනය කරන රටකින් හෝ දැනට මිලදී අරගෙන තිබෙන රටකින් මේ ලබා ගැනීම සඳහා කටයුතු කරනවා. ඒ නිසා බොහෝ දුරට ඉදිරි මාසය ඇතුළත අපිට ඒ ලබා ගන්න පුළුවන් වේවි.
Meanwhile, the message from the World Health Organization for those still undecided about being vaccinated is very simple.
What we know now is that the vaccines work, the diagnostics work, the same treatments that are used for the regular virus work, so there's really no need to change any of those, and in fact people should go ahead and get whatever vaccine is available to them and that they're eligible for.
Response to offers of mediation with foreign nations to secure COVID-19 assistance made by opposition leader Sajith Premadasa, the government says that it is his duty to inform the government of offers foreign envoys are willing to make to the country's opposition and not its government, so that discussions could be held through proper channels. Meanwhile, the cabinet has announced its approval of a proposal by the finance minister to obtain a tranche of $200 million from the Asian Development Bank as part of its highways investment program.
At this week's Cabinet media briefing, it was announced that approval has been granted for a proposal submitted by Prime Minister Mahinda Rajapaksa in his capacity as the Minister of Finance to obtain $200 million from the Asian Development Bank as the third tranche of its $900 million highways investment program. Under the ADB program, a total of 3,400 kilometers of rural access roads in the northern, eastern, Uva and western provinces, as well as 340 kilometers of national roadways connecting rural communities and socio-economic centers are to be developed. Further, in response to protests by environmentalists and conservationists over the threats to the Muthurajavela wetland zone, the Cabinet has also approved the drafting of a master plan to protect the 6,232-hectare area. This will also include the setting up of a monitoring committee and a working committee comprised of heads and representatives of the applicable stakeholder institutions. In addition, the areas identified under the master plan are to be declared as a national reserve under the Fauna and Flora Ordinance, while steps are also to be taken to declare it as a protected Ramsar wetland. Meanwhile, the Cabinet has also approved the granting of concessions to interprovincial bus operators from the 1st of April to the 31st of September in view of the current pandemic-related restrictions. These include the charging of only 50% of annual tender deposits and 50% of expressway temporary permit charges. Meanwhile, following a series of meetings last week between opposition leader Sajit Premadasa and several foreign envoys, where he requested donations of vaccines, PCR testing kits and mobile field hospitals, the Cabinet co-spokesperson has this to say on the Samaga Jana Balawegya's calls for an all-party conference, as well as its offers to mediate with its international contacts in sourcing such assistance.
ඇත්තම අපි දන්නේ නැහැ දේශ රටවල් ගණනාවක් විපක්ෂ නායකතුමාට ආධාර දෙන්න එකඟතාවය පළ කරා කියන එක. ඒ පිළිබඳ විපක්ෂ නායකතුමා ආණ්ඩුව දැනුවත් කරොත් ආණ්ඩුවේ අදාළ ආයතනත් සමග රටවල තානාපතිවරුන් හමු වෙලා ඒ ගැන සාකච්ඡා කරන්න පුළුවන්. විපක්ෂ නායකතුමා මේ දක්වා ආණ්ඩුවට දැනුම් දීමක් කරලා නැහැ. ආණ්ඩුවට ලබා දීමට එකඟ නොවූ ඒත් විපක්ෂ නායකතුමත් එක්ක එකඟ වුණු ආධාර ප්‍රමාණයක් තියෙනවා කියලා අපි දන්න ප්‍රමාණින් තානාපතිවරුන් එක්ක කතා කරද්දී ඔවුන් දැනටමත් අපේ ආණ්ඩුවට ලබා දීලා තියෙන විවිධ සෞඛ්‍ය සහ අනිකුත් සහන පිළිබඳ විපක්ෂ නායකතුමා දැනුම්වත් කරලා ඔවුන්ගේ සහයෝගය නිරන්තරයෙන් ශ්‍රී ලංකාවට ලබා දෙන බව ප්‍රකාශ කිරීමක් කරලා තියෙනවා. ඒ අරුණකොට රටට වෙනුවට විපක්ෂ නායකතුමාට යම් සහායක් ලබා දීමට එකඟතාවයක් වෙලා තියෙනවා නම් ඒ පිළිබඳව විපක්ෂ නායකතුමා ආණ්ඩුවට දැනුම් දීමක් කළ යුතුයි. මේ දක්වන අපිට එහෙම දැනුම් දීමක් කරලා නැහැ.
Meanwhile, the Cabinet co-spokesperson also responded to media questions on the recent projections by US entity, the Institute for Health Metrics and Evaluation, that claims Sri Lanka's death toll could reach 20,000 by September.
රජයේ වෛද්‍ය නිලධාරීන්ගේ සංගමය විසින් මෙම විශ්වවිද්‍යාලයෙන් ලිඛිතව ප්‍රශ්න කිරීමක් කරලා තියෙනවා. දවසකට 20000ක් මිය යෑමේ තත්ත්වයක් සැප්තැම්බර් මාසයේ ඇති වෙන බවට පැවසීමේ පදනම කුමක්ද කියන එක. මොකද ඒ ඉලක්කම බොහෝ දුරට අතාත්වික තත්ත්වයක් වෙන්නේ.
Now, the government has expressed its deep concern on the passing of Private Member Bill 104 on Tamil Genocide Education Week by the Ontario Legislative Assembly last Thursday. Foreign Minister Dinesh Gunawardena met with the Canadian High Commissioner David McKinnon at the Foreign Ministry yesterday. During the meeting, Minister Gunawardena had explained that the Ontario Legislative Assembly makes a finding that genocide has taken place in Sri Lanka, contradicting the official position of the Government of Canada, which had confirmed that it has not made a finding that there was a genocide in Sri Lanka. He had sought immediate intervention of the Canadian government to stop royal assent by Governor of Ontario to the bill in question. Foreign Secretary Admiral Professor Jayannath Kolamage, who was also present at the meeting, had elaborated on the potential harm the Bill 104 could cause to the reconciliation process, peace building and the bilateral relations at large. We will see you shortly. Stay with us. Welcome back. This is First at 9. Now, Sri Lankan shares closed higher today, lifted by financial, consumer discretionary and healthcare stocks. The CSE All Share Price Index rose 0.11% to end at 7,143.38, having climbed 5.45% this year, while the S&P SL20 Index of more liquid stocks up 5.21 points to close at 2,843.4. With that, here's Dimantha Matthew with a more detailed report of how the bulls behaved today.
So we are continuing to see the swings in the market to happen now. After yesterday's heavy decline, we are today again seeing a marginal gain in the market. So the ASPI is now hovering around the 7,143 mark today, which is the closing rate after the index was up by around 7 points. So with that, what we are seeing in the market is that investors are again starting to be on the sidelines with the number of new patients or the positive patients is increasing at a rapid rate, and the restrictions are going on at a significant level. So with that, we are seeing some sort of swings in the market, the volatility in the market, mainly because the investors are in a confused mindset. So there is a bit of selling pressure in the market as well whenever there is panic selling with such drastic news coming in place. However, afterwards we are seeing a certain stabilization in the following days.
And now for an update on the global pandemic situation, Director General of the World Health Organization, Dr. Tedros Ghebreyesus, revealed that the situation world over is improving with new cases and deaths currently plateauing. The condition in Southeast Asia, however, remains a contradiction to the WHO chief's statement, as COVID cases and deaths emerging from that part of the world are showing an exponential rise.
India, the worst hit country by the pandemic, recorded 329,942 new cases yesterday, with the death toll standing in the excess of 3,000. This marks the 20th consecutive day that India has seen daily confirmed cases top 300,000 mark, exacerbated by a more virulent strain which the World Health Governing Body has termed a variant of global concern. Meanwhile, bodies of suspected COVID-19 patients found floating in the river Ganga has triggered further panic in several Indian villages. The Gamar village in Ghazipur district of Uttar Pradesh recorded about 100 such bodies that had been washed away from a riverbank, with some bodies reportedly lying there for 2 days. China, in the meantime, plans to set up a COVID-19 separation line on the peak of Mount Komolangma to prevent the disease from being spread by climbers ascending the Nepali side of the mountain. The separation line is expected to be finished in mid-May before climbers this mountaineering season reach the mountain peak. So far, China's side of the mountain has not reported any coronavirus infections. Meanwhile, in northwest Syria, where healthcare is rudimentary, the arrival of vaccines to fight COVID-19 should have been a cause for relief, but instead have faced opposition. A UN-backed vaccination campaign has met with suspicion and mistrust by an exhausted population who say they feel betrayed by their government and abandoned by the international community after a decade of conflict that ruined their lives. In the meantime, as the novel coronavirus tightens its grip on the world, confirmed COVID-19 cases have passed 158.9 million globally, and the number of deaths stands at more than 3.3 million. However, the World Health Organization is of the view that the situation is improving.
Globally, we're now seeing a plateau in the number of COVID-19 cases and deaths, with declines in most regions, including the Americas and Europe, the two worst affected regions. But it is an unacceptably high plateau, with more than 5.4 million reported cases and almost 90,000 deaths last week.
And that's it from all of us here at First at 9. Thanks for watching. Bye-bye.